On a fall day when we meet Chelsea Long and her sons Henry and Archimedes,
Henry, come here.
Henry puts fear in his mother's heart.
You might run.
Henry has autism. He needs things like speech, occupational, and behavioral therapy to help him function.
Henry, stop. Henry.
But the 2.5-year-old has not been getting his therapies lately.
Henry, no.
That's because about 2 months earlier, the Army transferred the family from Texas to Virginia's Fort Belvoir.
Yep, I know, it's about to go down. I know. Okay, come here, mommy ups.
And they say they've encountered red tape with the military health insurance system called TRICARE.
And so he's not been talking as much. He doesn't like social situations. We can't go to the grocery store because he'll have a meltdown because we tried the tools we did in Texas, but it's just not working.
A new study by Children's Hospital of Philadelphia reveals getting consistent care is a challenge a lot of military families face. They move every 2 to 3 years, so every 2 to 3 years, they have to redo paperwork and find all new doctors.
And then they said, you'll need to get new referrals because you're going to TRICARE East.
What was that like to hear?
Frustrating, because it's not fair to us that we have to keep starting over from square one, because it's exhausting. And not just for him, but for us as parents.
In their first 2 months here, records show they've only been able to get into one of the 6 specialists Henry needs to see.
It's sad for me. It's a lot of tears shed because of it, because it's just not fair that him or anybody just gets dismissed. I mean, we have access to health care, and yet we don't get it, like, at all.
Henry's case is not the exception, according to Karen Rudicelli, a former military spouse who was involved in the Children's Hospital of Philadelphia study. It's the first time researchers compared the experiences of military kids and civilian kids on this topic.
You cannot imagine what it's like to be a military family until you're in the thick of things.
It looked at more than 84,000 children with all different kinds of health insurance. It found military families with TRICARE are less satisfied with access and quality of care when compared to families covered by private health plans. Their satisfaction is more comparable to those covered by government insurance or even those who are uninsured. Data shows this is especially the case if your kid has complex needs, like Henry. According to the study, some of these findings come from the challenges that are unique to military families. Their stresses and access to care can be different than their civilian counterparts. For example, long deployments create strain, and those children can have more medical needs. On top of that, a lot of military installations are located in remote areas where specialty care can be hard to find.
It goes beyond the inconveniences that families face in terms of these delays to medical care or the hoops that have to be jumped through to access the care. And it really gets to the implications for the kids.
We took the issue to the DoD Office of Defense for Health Affairs.
I don't really believe that it accurately reflects the rich benefit that we provide our military families.
Dr. Terry Adiram says they've made changes, including increased case management for special needs families and expanded coverage for autism services.
Come on.
We take it seriously, and we know that since the time of that study, which was up until 2015, that we have made a number of improvements.
We've talked to families who have had issues in just the last few months. What do you say to those families?
Well, you know, we really want to hear about what their experience is like.
Chelsea hopes her experience leads them to streamline the process when families move.
Is easing that process something that you guys would consider?
Oh, absolutely, and it's something that has come to our cognizance, but when these issues come to our attention, we do look for ways to ease that burden on families.
You make me happy when skies are gray.
As the mom of 4 tries to soothe Henry with his favorite song, she prays her family's story will in fact prompt change.
You're okay.